Hello and welcome to today's webinar hosted by eLotus and sponsored by Evergreen Herbs. We are proud to be your source for quality CEU content. Having provided educational courses for over 2 decades, our goal is to help you elevate your knowledge and expand your skill set. With over 250 speakers, 900 courses, and a staggering 3,500 hours of continuing education, we are committed to providing you with the best educational experience possible. My name is Donna Chow, your host and your moderator, and I'm thrilled to be guiding you through this session today. Today's class is Unexplained Infertility, Treatment with Acupuncture and Chinese Medicine, Part 2, presented by Dr. Kim De La Cruz. The class will run from 9 to 6 p.m. Pacific time and we'll have 4 breaks, and Dr. Kim will let you know when those are, and our lunch is scheduled from 1 to 2 p.m. All right, so before we get started, let me highlight some important Zoom features. First, we have the chat room. It's an excellent tool to connect with your fellow colleagues, and I encourage you to set your chat preference to everyone to make it inclusive. Secondly, the Q&A box is where you can ask your questions for the speaker. Please do limit your questions to relevant topics to keep the session organized and efficient. Lastly, for those who qualify, the CEU quiz will be available the following workday, and I'll send you an email when that's ready. Our speaker today is Dr. Kim De La Cruz, a licensed acupuncturist and herbalist with over 20 years of experience, and her expertise in the field of Chinese medicine has helped many couples struggling with infertility. Dr. Kim, we are very excited to see what you have in store for us for part 2 and invite you to share your PowerPoint with us. Let's get started.
You'll see the toolbar.
Let me see. It's still coming up. So let's see. Yeah, we still see in toolbar. I think it's okay, Kim. We just go with that.
Okay.
Yeah, okay. Well, in the break time, we will,
Figure
try
it
it again.
out.
Yeah, that's fine.
Okay, thank you. Welcome back, everyone. Sorry for technical difficulties. I am not tech savvy. So yesterday we talked about Western medicine and infertility for most of the day. And then at the end, I talked about a little bit about diagnosis and the view of infertility in traditional Chinese medicine. So today we're going to move forward and talk about the different diagnoses we can get for infertility on the Chinese medicine side. We'll go through 15 sort of causes that could be causing infertility. And then we'll look at the points, acupuncture, and herbs that could possibly help. So for most of the day, we're going to do the Chinese medicine, and I'll kind of intersperse some therapies such as diet and exercise and supplements. And then maybe we'll revisit some of the Western medicine. For every cause we're going to go through, we're going to do 15, 16. I'm going to review the Western medicine causes and symptoms, because when we do Chinese medicine, we ask about symptoms. So the way we diagnose is symptoms and asking questions and observation, pulse, tongue, palpation. And that is how we come to a diagnosis. So we kind of go in a sort of backwards fashion. The way that I see the integrative portion of what we do with Western medicine is that they come to us with symptoms, and maybe they have gotten diagnostic tests to give a diagnosis so that they can narrow down what it is, and they put a label on it and they say, oh, you have endometriosis, or you have PCOS, or you have scarring in your fallopian tubes, or your endometrial lining is thin. For us, as we approach infertility, we look at what their symptoms are. They could have pain, they could have bleeding, they could have cramps, they could have irregular periods. But we can't do much with the Western medicine diagnosis. We work from the symptomology. So we kind of work backwards a little bit to get our diagnosis for Chinese medicine, because what we're trying to do is harmonize the body, not get rid of something. So your body, for the most part, with patients, they should, health. We just discussed what health was, and if they're not feeling pain, if they're having regularity in their cycles, then for us, that's good. And there's nothing really wrong, right? There's the diagnosis of a PCOS could just be a diagnosis, but if they're having, now they're having regular periods, or now they're not having so much pain, then we're good. Then they should be able to, move forward and have a chance to get pregnant. So the other thing I wanted to talk about, so I apologize for the end of yesterday because you couldn't see me doing yoga. So today, if we do have time, I'm going to move my screen to the front room, so move my computer back so you can see my whole body. Or we'll just do exercises on for the upper body. The other thing I wanted to talk about was on my Facebook group, Acupuncture, Herbs, Gynecology. If you guys want to join, I will probably in the next couple of days post a book list and maybe article list of where I get some information from for fertility, because I think having a book list, I didn't add it to the PowerPoint, is really nice so that you can start to dive into where you want to get information. If you're just starting out doing fertility, a lot of people are interested in fertility, but they don't know where to start, and you can, get some books and articles. So I've pulled some information from different sources, and my teachers have given me information, and maybe some of my information is not in a book. So hopefully you get, all of it will help you go and move forward to treat your patients with infertility. All right, so let's move to the next slide. So this lady in China, this was called a doctor's lady. This is an ancient medical Chinese doll, a diagnostic doll. It's a small sculpture of the female figure. And it was historically used in China and parts of Asia as a tool. Because when a woman would go to the doctor, men were primarily the doctors, and visits to physicians by women during this time were restricted because there was modesty, and contact between genders were restricted, and physicians were almost always men. So they were the visits were conducted where the woman was behind a screen made of bamboo, and the woman would reach out her hands from behind the screen with the medical doll, or to show on the medical doll where she was having pain. So the prevailing attitudes of feminine modesty was improper to gesture to her own body. So if I were to go to the doctor, I couldn't point to my, shoulder, or my breast, or my uterus. My stomach was hurting. So when seeing a physician, a woman would indicate her medical issues by pointing to the doll. So sometimes people will find these at these, thrift stores or something, or their parents will have, and they wonder why they have these dolls, because they're actually I think they're rare, especially the older ones. So nowadays, when we go to the doctor, we don't need a doctor's lady, but of course, many of many of the OBGYNs and reproductive endocrinologists are women, so women feel comfortable, for the most part, seeing other women doctors. And for Chinese medicine, there are a lot of Chinese medicine physicians that are women. So when fertility, I would, I think a lot of women feel comfortable coming to see me because I'm a woman, but I'm not, I'm not saying that they wouldn't feel comfortable going to see a male doctor for fertility, but then there's also this, I understand because I have a menstrual cycle. I understand that, this happens. Whereas maybe a male doctor might not. But that doesn't mean that you can't get good treatment and acupuncture and herbs from a male Chinese medicine practitioner. I just think that most patients feel comfortable with women. I've even had patients that come to the clinic that require, my ethnicity. They say they want all of their, doctors, including their primary care doctors, their endocrine doctors, to be women and also Asian. So that's kind of another strange thing, but maybe because of the culture or to understand a certain thing about, there's even a reproductive clinic that is here in San Diego that does international. So they have a lot of non-English speakers. So they'll do IVFs with women that are from Japan or China or some South Korea, and they actually come here to do their IVFs because this actual reproductive clinic has a lot of doctors that are Asian, and also they have if they require eggs from Asian donors or sperm from Asian donors, this is the clinic, which is kind of strange because I didn't realize there was places like this where they really focus on a certain culture for, IVF. But a lot of Asians from overseas will come and want Asian, and it's very hard to get Asian egg donors and sperm donors because maybe culturally it's not, looked well upon, but nowadays people are starting to seek treatments, and it's expensive. So they're going to come all the way over from South Korea or from Japan and come to the United States to get their IVF. Okay, so let's move on. So this is a nice quote from the Yellow Emperor, the Huangdi. That's where it's attributed to. The superior doctor prevents sickness. The mediocre doctor attends to impending sickness, and the inferior doctor treats actual sickness. Well, in our medicine, of course, we want to prevent sickness, but that means that people have to focus on preventive care and keeping their bodies balanced and vital, and also doing work at home with diet, exercise, stress management. But they don't really promote that in Western medicine. They only see you only go to the doctor usually in Western medicine unless you're being managed by a doctor for something like diabetes or high blood pressure. They see you on a regular basis if you have meds. But normally, like from maybe age 20 to whenever 40, they don't have to see you. Maybe you can go to the doctor, get blood work if you don't need to. They don't really require any specific yearly exams, as a young person until maybe around age 40, where they start to want to test you for things. But for Chinese medicine, I tell my patients, and I have patients that have gone to their Chinese medicine physician since they were kids because their parents brought them. So they're culturally, doesn't mean that they're Asian, but like I have patients that said, my mom brought me to acupuncture when I was 3, when I was 5, and now they're bringing their kids to acupuncture and getting herbs. Same, that you start to do that at home with your kids, they'll get used to it, and they'll know that it's kind of a normal thing to go see, Dr. Kim, she's super cute, little 3-year-old, lays down on the table ready to go next to her mom. So then I think that's that's for them. She's starting to get used to, like, are we going to go see Dr. Kim? Yes, we're going to see Dr. Kim today. And she knows I'm going to actually put needles in her. I'm going to do massage or gua sha or the shonishin. But, the impact, like culturally and, the West, they don't see Chinese medicine as being equivalent because, maybe we're just doing something like like small, like balancing, the GI system, like you have a stomach ache, you're constipated, you have diarrhea. Most people don't think that they can, go to the Chinese medicine doctor for that. They think, oh, I'll just take some, over the counter thing, to make me go, or I'll just Miralax or whatever. And that's just the Western medicine view. So we kind of had to educate our patients on coming for preventive care and for minor things, because Western medicine is kind of harsh for the most part. From yesterday, what they do for infertility is hormones, shots regulating your period with hormones, and IUI and IVF. But for Chinese medicine, when we do fertility treatments, we're working on their GI system, or we're working on their immune system, or something, because it's not just the fertility that we're focusing on the whole body and their whole health, which is fertility health. For most men and women, that's what we're going for. A healthy body will have health, unless there's physical structural anomalies. Okay, let's move forward. So this quote I put in our talk yesterday, but I just want to review it a little. Our review suggests that management of female infertility with Chinese herbal medicine can improve pregnancy rates twofold within a 3 to 6 month period, compared with Western medical fertility drug therapy. So actually this article says that we have better results, twice as better than just regular Western medicine. Even if we were to just do Chinese medicine and acupuncture, we have better rates of fertility than Western medicine drug therapy. In addition, fertility indicators such as ovulation rates, cervical mucus score, biphasic body temperature, and appropriate thickness of endometrial lining were positively influenced by Chinese medicine therapy, including ameliorating physiological effects conducive for a viable pregnancy. And a lot of times you're going to tell your patients the 4 things that I talked about at the end of the talk yesterday. You're going to say acupuncture and Chinese medicine improves blood circulation to the uterus and the ovaries. It helps balance the hormones. Acupuncture and Chinese medicine helps balance hormones. Acupuncture and Chinese medicine improves egg quality and sperm quality. And acupuncture and Chinese medicine reduces stress and alleviates the problems in the nervous system. So there's 4 things that you could always roll off, when someone asks, well, what does Chinese medicine and acupuncture do for fertility? Well, those 4 things are the things that you normally would say to your patients inquiring about fertility. And they can just do, Chinese medicine and acupuncture, or you could be doing it together with their reproductive endocrinologist. So then, okay. So the recap yesterday, review of Western medicine of unexplained infertility. So we kind of went over a little bit that could happen with the hormones, with the structures, PCOS, endometriosis, and the labs, how they diagnose and what their treatments are. So the diagnosis, basically, their medical labs and the scans. That's how they would diagnose. And then the treatments were just hormones and IUI or IVF. And then we talked a little bit about the Chinese medicine theory of reproduction and how we would treat someone coming into the clinic. So basically we talked about the kidney function, and then the associated other zang and fu organs that come into play with blood and jing and yin and yang and qi, and how we would treat, from that perspective. And that is mostly regulating the menstrual cycle. We're going to focus more on the woman, but there are, like I said, 20 to 25% of my patients for fertility are men. Review of some of the Western medicine diagnosis and treatments. Yeah, we talked about that. And then infertility treatments in the West has limitations. So yeah, we talked about that. Very rarely will you see an OBGYN or a reproductive endocrinologist talk about diet, lifestyle, supplements. They don't even know. Actually, they don't even take classes in nutrition in medical school unless they want to focus on it. So they're not going to know anything about food. They're not going to know anything about supplements. So many patients will go to a naturopathic doctor because they probably know more. A functional nutritionist. I have a patient who I treat fertility, and she's actually a women's health functional nutritionist. So I like talk to her about a lot of different foods and also functional medicine supplements to help with fertility, because that's what she does in her practice. She used to treat children. She was a therapist for children, and now she's focused more on women and fertility. So that is a nice little referral that I have for more of my patients in the clinic. But yeah, very rarely will you see doctors, Western doctors, talk to their patients about, meditation or stress management. They'll say exercise, or they'll say lose weight. They don't tell you really how to lose weight, and they don't really know what type of exercise. They just say exercise, or they say, go to the gym. For us, we get really more specific about what type of exercise and what type of food to eat. And you can do that, the Chinese medicine diagnosis, what your patients present as, and what you think that they would benefit from with their diet. For the most part, fertility health, you're going to focus on nourishing the blood, boosting kidney qi, yin yang jing. So kidney and nourishing the blood. Those are the things that I would tend to look for just, telling people what do I eat, for fertility health. I would say, well, if it's the kidney, I would say dark, leafy greens and dark berries, and then to limit some refined foods and certain oils. So we're going to talk a little tiny bit about that today too, with supplements and foods. I'm going to kind of pepper it in as we go along, and also some case studies as I remember them. So let's go to the next slide. So multiple reasons why someone may seek fertility assistance. And you see this circle, and at the top it says unexplained infertility, but all the other ones are also reasons why they may come to see you. They might hear in the news, or hear from their friends, or hear from a doctor that knows that acupuncture and Chinese medicine treats male infertility, female infertility. We help single parents going through IVF or IUI, LGBTQ patients that want to have children, also IUI, IVF. Sometimes the LGBTQ population will also get donor eggs and donor sperm. So sometimes that is another level of added stress. And then iatrogenic infertility due to medical treatments or chemo or radiation. Oh, that reminds me, I had a patient, she was probably 23 or 24. She was working as medical personnel overseas in the Middle East. And she was diagnosed with breast cancer. And at that time, her doctor said, once we go through treatment and we do radiation chemo, you will not have a good chance to have healthy pregnancy. So they right away told her to do egg retrieval, to harvest her eggs so that she could freeze them. And if she decided later on that she was wanting to have kids, that she could do IVF. So they told her to do egg freezing, which at that time it was very confusing because, as on top of having the breast cancer diagnosis, she was told by her doctor to do egg retrieval. So she had to get all these hormones. So you saw that chart yesterday for an IVF where they do the Lupron injections and progesterone for egg retrieval and HCG and HMG. She was doing that right, like the two months, maybe 3 months right before she had to start doing treatment for breast cancer. So I was treating her, and she also had other things going on in her life. She was kind of a minimalist, didn't want to live, in an apartment. She didn't have family help. So what she ended up living in a van. It's a very crazy story. And she was living in a van. She had like a backpack full of her stuff, and she was doing all these treatments to do egg retrieval, coming in for acupuncture every week, and then not feeling great about her future financially and or physically where she was going to be. She didn't want to live in San Diego, so she was actually living like her family lived in Orange County, I believe, but she didn't want them to help for some reason, and so she lived out of her van. And it was really rough because she was stressed out about having to do egg retrieval. But she was a rock star, young lady, and very, vital lady. Even though she had that breast cancer diagnosis, she was healthy for the most part. And she didn't start feeling bad until all the hormones got pumped into her and she had to do egg retrieval. So I think she probably got like 20 eggs. They did 2 or 3 egg retrievals, and she got 20 viable eggs to freeze before she had to do her breast cancer treatment. So that was kind of a wild ride. But you'll see a lot of women doing single parenting, wanting to do egg retrieval first. And if they decide or don't have a partner later on when they get older and they want to have children, they'll do IVF on their own. There was a woman I treated who was from Australia, very intelligent, had her PhD, scientist, focused on her career and wanted to have a child. And I think that was around 18 years ago, and she was going through IVF, the egg retrieval first, and she was an older, I think she was closer to 36, 37. So they're having some more complications with her and her IVFs. I think she had probably 2 failed IVFs, but they were still going forward to try to get her to get pregnant. But yeah, no, she was going to be a single parent. At that time, I think 18 years ago, that was a little bit rare. I'll share with you an article that I found just recently where there was a lawsuit in Beijing for a woman who wanted to freeze her eggs because she wasn't ready to have children yet, and she wanted to have children later. And the bank, the place where she was trying to retrieve her eggs and freeze, they denied her. They said, no, you can't because you're not married. So that was just like a week ago. So she was in a lawsuit in China about that because of the culture. They didn't want you to be a single parent. All right, so what else is on here? So this kind of shows multiple reasons someone's going to come in for fertility, and we're going to kind of some of the things that are listed on the little blocks, male factors, problems with ovulation, and the genetic or disorders, hormone dysfunctions. Those are kind of that's what we're going to go through today. Some of them PCOS, endometriosis, fibroids, polyps, genetic disorders. You'll see that as we go through today's talk. Next. Oh, yeah. My little aside. Most women get put on hormone schedules for Western medicine, treatment of infertility. It's dictated by birth control and or Clomid, that Lupron, letrozole, progesterone, estrogen, all their hormone drugs. And then they have their timing. You have to be on their schedule, get your blood drawn, get your ultrasounds. And the Western medicine, the reproductive endocrinology clinics will test you rigorously first before they determine how to go forward with their fertility treatments, whether it's IUI or IVF. And they'll go and review your labs, and they'll sit down with you and say, well, we think that you could do, a few IUIs, we'll try. Or some of them will just say, no, we have to go right away, IVF. We have to do it now because your AMH is too low and your egg quality might not be as good. So, around 39, 38, 39, they might just say IVF right away. So after 35, normally they would promote IVF. Some patients will wait because maybe they'll get pregnant naturally within a few years, but maybe by 38, 37, 38, they're going to be in IVF. Their doctors are going to promote IVF. And also, I talked about this yesterday, some of my patients will say, well, the IVF clinic says I can, try 3 times or 4 times. And if it doesn't go through, they kind of guarantee you a deal. Like if you don't get pregnant after 3 IVFs, they give you a deal or something like that. I don't know. It was weird because I kept thinking to myself, 3 or 4 times. I was like, wow, IVF 3 or 4 times is really hardcore. Well, hardcore financially and hardcore on your body. So I talked about that yesterday where women were going like 5, 6, 7, 8 times IVF and trying to push their bodies. So that is another kind of situation we can have with patients coming in for acupuncture and herbs. They're just very stressful, sort of type A, pushy, high maintenance. And these are patients that maybe acupuncturists don't like. So that's why they don't want to do fertility. But if you're, conscious and compassionate about what their journey is and you want them to help them, you will kind of, push that to the side because that's just a lifestyle that they want to live. And if you want to support them, then this is what you're going to do. And that's what we do. We support people in health. In both sides, Western medicine and Chinese medicine, support people in their health. So Chinese medicine and acupuncture see unexplained infertility from a total body health perspective, because you can't really explain. We don't have diagnostics like Western medicine. We don't say, oh, it's because of your fallopian tubes. Oh, it's because of your egg quality. We see the body as just one whole big planet of health. And things are moving, things are good here, things are not so good here. It's not the way Western medicine will deconstruct labs or, parts of the body, as you go, you'll see like, oh, well, if you have, 2 fallopian tube defects, well, then we fix the fallopian tubes. Not so much like what is the underlying cause, or if you have hormone issues, then they'll just focus on the hormones, where that is also, there's no underlying cause. They don't look at that. Versus us, Chinese medicine, we see the body as kind of a balance, healthy balance, and movement of qi, proper movement of blood and qi. This is very basic. Then you're able to help them conceive and support a healthy pregnancy because you're looking at their body like a moving landscape, like the world, like the earth. It's not, oh, something's wrong with it. It's just the whole kind of interacting, interconnected system. So we've got yin and yang, qi and blood, jing, hot and cold. And then that's pretty much the basic treatments for any type of thing in Chinese medicine, but fertility, focus on blood and the kidney. I'm going to keep repeating. Okay. So mostly treating women, for sure, in the clinic, mostly treating women for infertility. So you'll see herbal supplements, most of them for women. I do have a section of male fertility factors, and we'll talk about, it's a little different for men because of hormones and also blood and qi. So yeah, hormone-related symptoms, men too, hormone-related symptoms. So our cycles are 28 days every month. And I haven't seen this in anything that I've looked up or checked for, but men also have hormonal cycles. If you notice, if you have a partner, a male partner, I think it's like a 3-month thing. Like they have this sort of, if women have this monthly cycle, I think men have like a 3-month cycle where they just feel kind of low and down, and then they pep back up, and then I don't know what that is, 90 days probably. If you guys notice this, maybe you could correlate it with me. but because I've noticed it with men where they get kind of low and like sort of this PMS-y, correlation to women, theirs is 3 months. So we're going to talk about this most of the day, regulating the menses, regulating the menstrual cycle, what that means in herbal and acupuncture terms, and how that relates to the Western medicine, like fertility, ovaries, egg quality, fallopian tubes, uterus, blood, nutrition. So women. So we're going to see women in our practice. We're doing women's health. A lot of us do women's health. It's, I think women want to feel better in their lives on a day-to-day, and they notice things. They're a little bit more, they pay attention more to their bodies, I think. So they're going to feel like, oh, I don't feel so good here. I got to go to see, Dr. Kim. I'm bloated. I feel heavy in my lower limbs. I feel like I'm going to catch a cold. I have pain, stabbing pain on my left side. These are things that it will prompt them to come to see me because they know it's something, and they don't know what it is, but they're pretty sure it has something to do with their hormones. So regulating the menstrual cycle, perimenopause. You'll see maybe with the older women that are coming to fertility, like I have some women that are at 39, 40, and I think I had like a 43. I might have even had a 46-year-old that they do not have any menopausal symptoms, and they'll still have a regular period. So they're still trying to get pregnant naturally, which is nice. So this older population of women that are still that are having a regular period, healthy lifestyle, and they possibly could get pregnant naturally. I don't know what, for sure the statistics are for how successful they are, in later years, just doing acupuncture and Chinese medicine. But I feel like it's a little bit higher, because if they're healthy, then they could possibly have a healthy pregnancy. Their cycle is normal. Menopause. I've seen women in menopause, menopausal symptoms could happen in your 20s. So we're going to talk about that. Diminished ovarian reserve, premature ovarian insufficiency, where the eggs are low. And you'll see women in their 20s, sometimes even younger, having hot flashes, or the dryness and low yin deficiency. It's very, very apparent that they have yin deficiency, amenorrhea, no periods, and that signals. And once they do their Western medicine blood test, they'll find out that, yes, they are in menopause at that young of an age, and their bodies stopped producing hormones to have a healthy cycle. Now, with those patients, if they are if they're guided by their Western medicine doctor and they're taking hormones, they might not be able to get pregnant. Their doctor has had the discussion about whether or not they can get pregnant, either naturally, IUI, or IVF. And sometimes their doctor just says, no, you won't be able to get pregnant. And I see that is, the case for, in our side, traditional Chinese medicine. If you notice, if you read labs and you're talking to your patients, and you notice that maybe this patient might not be able to have children, you have to talk to them about that. And what options do they have? So here I said, happy woman equals happy life. And when women come to see me in clinic, if they're married and they have children, they're running a lot. They're doing their work, they're doing, home, they're doing the kids. Then I'm like, well, what does your partner or spouse do? And they're stressed out, but they also take care of their spouse. And here, take these herbs, here, take these supplements. They basically are running the whole show. So if your patients are coming to have stress, stress management, and they just feel overwhelmed, you just tell them to come every week, because they need to be, regulating their liver chi and their hormones so that they can, be happy in their daily life. So then they can go and tell their husbands, I need to go to acupuncture so that I'm happy. Oh, I think I talked about this yesterday too. It's kind of a review. I talked about Julie Shen asking in the Acupuncture Herbs Gynecology Facebook page, how do Western findings match to TCM patterns? And normally they don't. We talked about progesterone being yang, estrogen being yin, and the structure of the ovaries and the fallopian tubes and the uterus being jing, sperm, yang, the egg, yin, blood. Blood is blood. So chi is function. So we're going to talk about chi as a function. So if something is not in regular function in the in the Western medicine, so if something's not functioning properly, whether it be normal, regular ovulation or sperm production or quality, these are going to be addressed with chi also. That's just a general rule of thumb. So function is chi, and structure is blood, for the most part. Western medicine has very limited tools to reveal a cause for infertility. And like I said, they're trying to come to a diagnosis and move forward from there with their hormones and their IUI, IVF. And then that's pretty much it. So they're narrowing it down. They're saying this, you fit in this box. Hopefully you fit in this box. So therefore, these are the treatments for you. Sort of like their puzzle of how to go forward and treat infertility. And for us, it's also a puzzle, but a little bit different puzzle, because we're not just focusing on blood tests or scans to fit them in a box. We're mostly saying the general, kidney chi deficiency, spleen chi deficiency, liver blood deficiency. And that is a huge basket of things. With Chinese medicine and herbs, you have your liver qi stagnation formula, Xiao Yao San, Xiao Yao Wan, and then you adjust based on other things that they might be exhibiting. So there's a little bit more play in our puzzle. There's a little bit more sophistication in treatment based on our patient-specific conditions. If they have dribbling urine or a cold hands and feet, or coxcrow diarrhea, spleen and kidney yang deficiency, we're going to give them some herbs to address that. On top of their nourished blood and move liver qi, not all at the same time, but as their cycle, we're going to look at balancing the regulating the menstrual cycle on their different phases: menstrual cycle, follicular phase, and ovulatory phase, and luteal phase. So that kind of goes well together with Western medicine, because we're looking at the cycle also from a Western medicine point of view. Oh yeah, this chart. So estrogen yin, follicles and ovum jing, progesterone yang. They didn't put sperm here, but that's jing. So that's kind of a basic chart for the. And then there was a nicer breakdown that Dr. Nee had done. I don't know if I included it here. Oh, this one was mine. Problems with yin, sort of estrogen, problems with yang, progesterone, testosterone. So they're going to come and you're going to see their labs. They have low E2, if they have low progesterone, if they P4, if they have low testosterone, T, total T, problems with Qi. So I think about function, strength, and the flow of things, fluids, energetic flow. Those are symptoms that will come up more like stagnation. So Qi stagnation, their tongue is kind of purpley, dusky, or they have pain, or they have clotty blood. So that's heat. Also with Qi, Qi deficiency can cause stagnation, which causes heat. Cold can also cause stagnation. So getting down to really focusing your diagnosis on whether it's hot or cold, if it's yin or yang, if it's a problem with Qi or blood. These are things you have to keep in mind when you do diagnosis with herbs specifically. Problems with the blood, so the structure, reproductive structure, so the uterus, the testes, blood consistency and amount. So there's charts I think there's some charts that show, I'm pretty sure I remember seeing, the consistency of the blood. If the blood is dark, if the blood is light, blood deficiency, if the blood is clots, there's little clots, there's larger clots. If there's a prolonged period, if you're bleeding a long time, longer than 7 days, or if you have a short period, this could be stagnation. Also, I've noticed this too. I've said this to patients where you want to have a menstrual cycle that is shedding the lining well enough that your endometrial lining is back down to like 2 or 3 centimeters or millimeters, because it's also shedding old estrogens and old hormones. So you basically, all your hormones are kind of reset again after your menstrual cycle. So when I do treat the menstrual cycle, if there's problems with hanging on to the endometrial lining, if there's thickened endometrial lining, you want to do your herbs that focus on moving and invigorating the blood so that you're shedding the lining of the uterus to that low endometrial lining so that they can build up again new hormones and estrogens. Because if you have an overly thickened endometrial lining, you have estrogen still in the lining, and then you're building lining again that next cycle and you're adding more estrogen. So you'll see kind of this estrogen dominance with like thicker uterine lining. And that can cause problems for fertility. So a lot of times with menstrual cycles, we want to really invigorate the blood, move the blood, unless they're bleeding like heavily. And the amounts of blood that you shed there, I think we're going to talk about this later for one of the symptoms we're going to go over is, how much blood is too much blood. If you're changing your tampon or pad every hour or less because of flooding or you're leaking through, then that's too much blood. If you don't have to change your pad or tampon for 2 to 3 to 4 hours, that means you're bleeding very lightly. So that's something that you can tell your patients, because they don't know actually what's heavy. Sometimes they'll say, yeah, it's heavy. But then I'll say, well, do you change every 2 to 3 hours, or do you change every hour or less? And they'll say, no, it's about 2. Then I'd say that's normal. That's normal. That's not too heavy. Sometimes they'll have a heavy day, like a flow, like one day is heavy, and then the next day not so heavy, and then the third day they're heavy again. So that's also another interesting indication of something in their body with hormonal factors, like the lining's not getting shed fast enough, or they have some stagnation, Qi stagnation. Where are we? Oh, Jing. Problems with Jing, genetic disorders, reproductive structures. So these are only found really with scans in Western medicine. We don't really know unless they're telling us either their results from scans or that they have, issues. Jing issues is like not ovulating, they're low AMH and or low sperm count, or they have, structural issues. The uterus is not formed, or the fallopian tubes are not, one of them's blocked, or or with that one patient I talked about yesterday who did not have a vas deferens, but he did have sperm. He just couldn't, transport it out when he ejaculated. So he could not get his wife pregnant at all, ever, until they harvested sperm and did IUI. Okay, so next. Okay, slide. Both Western and Chinese medicine regulate the menstrual cycle. So they'll regulate the menstrual cycle with hormones in an IVF or a egg retrieval situation, or even an IUI. But their hormones are really heavy duty, and most women will come after they have a shot or the patches, and they will not feel good. They'll tell you all their symptomology, and they'll know for a fact it's because of the hormones. Because hormones is a subtle reaction for most women. If you know that their hormones are out of balance, it's like they know. Mood changes, body energy, like sluggishness, fatigue, like water retention, even cravings, like dietary cravings. As women, I like to ask, and this is a good question to ask when you ask about diet, is what do they crave premenstrually? This is a question I ask all my fertility patients, all my women patients. If you have specific cravings for salty things or sweet things or sour things right before your period, that will point me to an organ system, liver, kidney, spleen. And then you'll start to kind of compile your diagnosis so that you know what herbs to give or what acupuncture to do. That's a good one. So pay attention to their cravings premenstrually. Sometimes they're good and they don't have any at all, and they're fine. They can eat whatever, and that's not like they really crave, chocolate. No, that's a big one. Chocolate. So what do you think chocolate is? What organ system do you guys think chocolate is? I think it's the liver, personally, and the heart. There's some hormones in there, make you feel good, that raise levels of that feel-good neurotransmitter. So I think dark chocolate, maybe the heart, maybe. Heart, liver, spleen, all of it. I think chocolate is just good for all of your organ systems. Okay, so TCM approach for treatment of the menstrual cycle. And this is not just Dr. Nee. I just read a few little blurbs with Dr. Jake Fratkin and Dr. Liu. That book I'll post on the website later, Facebook website later. But most TCM approaches to treatment of the menstrual cycle is to regulate qi before the menstrual cycle. So right before the menses, you want to make sure that qi is moving good. No crankiness, no pain, no stagnation of fluids, like your body's retaining water. And then the second is to regulate the blood during the menstrual cycle. So there's no, heavy periods or no light periods or clottiness. Also, not included in this TCM treatment of the menses is regulating the length of the cycle. We could do that with Chinese medicine also. Whether your patients are having shortened cycles, 22 to 25 days, still kind of in that borderline area of maybe too short to have good egg quality and ovulate, and have a longer luteal phase to get pregnant. Sometimes shorter cycle, it's hard to get pregnant. Sometimes. I would say 24 is 26 to 24 to 26 is my cutoff of like, I want my patients to have a monthly cycle that's over 24 days. So if someone comes in, they said, I had a 24-day cycle this month. I said, it's okay. You can still get pregnant because you ovulated and then you had a certain amount of time, the window, fertility window. But if your cycle's like 21 days, that's like, 10, 8, you're ovulating. If you ovulate, between day, 7 or 8 and day 15, and that's like, you just ended your period. So sometimes women with shorter cycles will have to start their fertility window and start having intercourse while they're still on their period to get the window. That's kind of, that's harder, a little bit harder. And then also longer cycles. So people that have had 40-day, 45-day cycles, I like to shorten those to closer to 35. 35 is my cutoff for like a good cycle for fertility. They can get pregnant a little bit easier. If you have like a 40 or 45-day cycle, then you don't know really if you're ovulating, if you ovulated twice, if you didn't ovulate. It's a little bit too long and too many different things going on there. And then to tonify after the menstrual cycle. So once you regulate the blood during the menses, you've gotten them on herbs to release all that extra estrogen that's in their lining. Their lining is good, their endometrial lining. And then now you're building chi and blood again in the follicular phase. So your egg is coming to mature and you want them to have enough nourishment so that the egg is normal and acts, that is hormonally balanced and is going to ovulate when it's supposed to. So we're doing a few things during the follicular phase. I think the follicular phase, mostly tonifying yang, qi and yang. So the structure and the function of the egg quality. And for men, it would be, sperm quality. I mean, they don't have a regular cycle, but I'm just thinking about men overturn sperm. I think it's like 24, 48 hours. They have to regenerate more. So sometimes with the fertility window, I'll tell them to have intercourse every other day so that their partner, the man can have a break to build sperm back up. But men sperm quality can be improved within a month. So it's very quick. If they're on supplements, if they have good diet, if they're not wearing, tight clothing or, too much bicycling. I told you guys yesterday about my one patient that had zero sperm. He was an avid cyclist, and they were saying maybe that was it because he had maybe it damaged his, testes, so he couldn't produce sperm properly. But that was just maybe they thought that. All right, next slide. Oh yeah, these are good. So Dr. Maciocia, or Giovanni Maciocia. So he had this nice worksheet that I found, what's going on with yang and yin and yang, and the blood, and then treatment principles during each phase of the cycle. So here we have the menstrual phase, where we have the transformation from yang to yin. Yang to yin. So yin is blood. And your treatment principle will be invigorate blood, nourish blood, or stop bleeding if there's heavy bleeding. So nourish blood if it's too light, if your period's too late. There could be something I also see during this menstrual phase is headaches, cramps. That's invigorate blood and move chi. But the headaches were, for me, if they're liver and kidney yin deficient and they have yang rising, they're going to have a migraine or a headache, is like a hormonal headache. So you have to tonify chi and blood more during the menstrual phase to kind of balance out the hormones. I think just the basic tonified chi and blood during the menstrual phase will help with that liver yang rising, because they just maybe don't have enough blood and chi. And so there's the hormones are kind of going kind of crazy a little bit. And then you've got the liver and kidney yin deficiency and causing liver yang rising, and there's some heat, and they just feel terrible during the first few days of their menstrual cycle. That usually does it. Just a little bit of chi and blood tonic in the menstrual phase, and their hormones kind of just back off. Follicular phase, which is right after the menstrual cycle. So we're going to stay like day 5, 7 to day 14 for a normal 28-day cycle. Yin is rising. So yin is building. You're building yin in the follicular phase. Yin is the blood for the most part. you're building the lining again going towards ovulation. You're building the lining slowly. So you want to nourish blood and tonify the kidneys. For the follicular phase, I like to use yin and yang tonics, yin and yang tonics for the most part, unless they have other qi deficiency signs or phlegm damp signs. Those are sort of like extra. So, but the major players are tonifying blood, nourishing blood, and the kidneys during the follicular phase, helping with egg quality. Let's finish this slide and then we'll take a break. Maybe I'll look at the questions. We'll finish this slide. I'll look at the questions and then we'll take a break. Okay. So then we're in ovulation. Ovulation phase, yin has reached its maximum and yang starts to grow rapidly. So yin is also estrogen. So you have estrogen that's also rising during this time. During ovulation, yin, the estrogen, is the highest. So estrogen is what spikes and decreases the temperature on a basal body chart. It's really quick though, because then you've got luteinizing hormone to release the egg, and then progesterone will rise, which is yang. And then your yang should be raising your basal body temperature up to the 98, maybe a little bit above 98 degrees. And that you'll see on the basal body chart that progesterone and yang has rapidly risen in the luteal phase. So the transformation is from yin to yang, so estrogen to progesterone, the focus, and qi and blood are active. You tonify the kidneys on the ovulation. So it could be 3 days of ovulation formula. Normally, I don't give ovulation formula if they're not having ovulation issues. I'll just keep my women that are doing fertility on 3 formulas: follicular phase, the menstrual phase, and the luteal phase. But I might skip the ovulation phase because it's like a 3-day cycle. I'd maybe have them on 3 days of herbs for specifically ovulation, unless, that's if they're having an ovulation issue. Like if they're not ovulating. They come and they say they don't ovulate, then I'm putting them on ovulation herbs. So you tonify the kidneys, you strengthen the spleen, and strengthen the spleen to hold structure, and nourish blood, resolve dampness. So egg could seem like it's more damp. I think it's because estrogen has created a more damp environment in the uterus. So you want to make sure that there's not too much damp, because it's like endometrial lining too thick, endometrial lining too thin. If you have stimulated ovaries and you have a lot of follicles, it's kind of feeling damp, retain water, feel sluggish. There's a kind of a yin excess signs. Luteal phase, which is after ovulation, eggs coming down the fallopian tube to the uterus. So yang is at the maximum in the luteal phase. You'll see the progesterone or the yang or the temperature in the basal body chart staying and hovering around that 98, 90, a little bit above 98. Sometimes they're warmer, sometimes they're closer to 99 temperature. But a good sign of pregnancy is if you see the temperature just keep on rising. Like if you're hovering around 98, maybe people's normal basal body temperature during the menstrual phase and the follicular phase is around 97, 97.1. If they ovulate and then maybe they come up to like 97.5 to 97.6, 97.7, which is a normal rise in temperature for the progesterone during this cycle. So 97.1 to like a 97.8. If you see it keep going, like 97.9, 98.1, 98.3, and it keeps on getting higher, I think it'll probably stop by around 99. It's a good chance that they're pregnant. So that's another fun if I'm looking at basal body charts and I'm looking and they're not testing their for pregnancy, they might be testing for pregnancy already because they're really some very exuberant early testers. They'll say, oh yeah, so I ovulated, we tried, and then like 3 days after they tried, they have intercourse, they'll test for pregnancy. Which I think to myself, you're not going to know by the test. You don't have enough HCG in your blood that for the over the counter home test to test. Sometimes it does, but really blood test is what's going to show you're pregnant. But the basal body temperature is also it's going to tell you that they could be pregnant. And I try to stay quiet, maybe because it could be not a viable pregnancy. Like if there's genetic stuff going on and they just naturally miscarry, they might get pregnant. And then, maybe they'll start their period a few days late and maybe they were pregnant, but it wasn't genetically viable. So your body will just shed the lining. Or it could be, a more serious thing like an ectopic. I kind of stay quiet a little bit. I won't say anything. I'll just wait until I'll, say a test for pregnancy. And then also for their Western doctor to check too. Because you want to make sure during that, first 3 months of they could be pregnant, those first like 6 weeks after they could be pregnant is a little bit stressful. So you don't want to say anything to make them stress out more. But sometimes women know in their bodies, they'll say, oh, I'm pregnant. I know this feeling, like if they've been pregnant before. Where are we? Yang at the maximum, yin decreases and then warm. So you'll see that basal body temperature. So the treatment principle for the luteal phase is to move qi, to free the liver and invigorate blood and warm the uterus. Invigorate blood, not so much because maybe they're pregnant. So I think about it too for the luteal phase. If they're actively trying to get pregnant, you don't want to invigorate blood too much. Maybe nourish the blood, but I like using gentle herbs to tonify and invigorate blood. And we'll see that later when I show you some more of the herbal formulas. Let's see what's in the chat for questions, and then after I get to these questions, we can take a little break. What are your main symptoms and signs of kidney jing versus kidney yin? So kidney yin, dryness more, jing more like anovulation, not ovulating. Jing, like a jing is like all encompassing kidney. Jing could be, fallopian tube defects, like hormonal things. Yin specifically could just be, one aspect of the hormonal regulation, like estrogen. Versus kidney jing, I think, is a whole complex. So it could be like a pituitary tumor, like a, prolactinemia, but it's like affecting all of the hormonal complex, not just that one specific one, like a kidney yin. So if I were going to tonify, if I were going to use herbs to tonify jing, I would do kidney yang formulas as well as yin formulas. So it's all of it, not just yin. Does that make sense? Signs and symptoms, kidney yin deficiency, dryness, fatigue, dry hair, dry skin, dry blood. That's a kind of blood deficiency, but the heat, the temperature, I think there's another kidney yin sign that I notice if they're specifically very hot, or they're having a hot flash, or they're having like the hormonal headaches I was talking about. This is a kidney yin. What can be indication both yin and yang level are high? Also like estrogen and progesterone, and how can it be treated? I don't know. It depends on what stage of the cycle it is. Because when they're kind of out of balance in a different, you can feel that they're out of balance. Like sometimes in the menstrual cycle, we're just going to say, I'm going to do an example, like the follicular stage, right after you have your menses. If estrogen is still high, like you're supposed to be building estrogen in the follicular cycle, but if estrogen is still high, you will still have these estrogenic symptoms, high estrogenic symptoms, like the fatigue, the bloating, the headaches, the water retention, right after their period, which was strange because usually women feel awesome. You know, after you have your period, you're like, all right, back to square one. I feel good. I'm going to go work out. I'm going to do all the things I need to do. I don't know, women can relate to this. But yang levels, so if your yang levels are high, like progesterone stays high, like I just talked about, progesterone stays high in the luteal phase, second phase, that means you're pregnant. So I wouldn't do anything. Actually, I wouldn't do anything. Yang meaning testosterone. No, that's like the PCOS. That's the PCOS model. So if we're talking about yang as a testosterone, and they have high levels of testosterone, you know, based on their Western medical blood test, then we're gonna work on like sort of a PCOS diagnosis on our side. So that's mostly spleen gene deficiency with dampness. And we're gonna try to like address it from from a supplementing spleen chi and removing damp to kind of lower testosterone. There's actually a really good testosterone point, Sanjiao 4. I love it. So every time I do Sanjiao 4 on women, if they have any testosterone issues, they feel awesome. So there's a little, that's later too. I'll show you Sanjiao 4. Good point for testosterone. What is the diagnosis in Chinese medicine when eggs have, oh yeah, there's a lady that Western, she is a acupuncturist. She talked about it. It's really to get the hormones, or not the hormones, the immune system to harmonize. Because it's like, I don't know what it is that the body, the female egg or whatever is allergic to in the semen as a component of the semen. But if it's like an allergy response, you know, you have, you know, white blood cells, eosinophils, histamines, all the things. It causes inflammatory response, causes like encapsulation. So whenever you have an inflammatory response in the body, your body wraps it in like a phlegm, something like this. So to cool the body, to cool it down, and to also shuttle it out. So it's like a normal immune response. It's like, hey, that's an invader. I don't want that there. Let's wrap it up. Let's cool it down, and let's kick it out of the body. That's the immune system. So for the semen allergy thing, we would probably need to focus on having the immune system calm down a little bit, because it's like an allergy. Any kind of allergy is going to have over allergy. And over allergy is like what your body should not be allergic to on a normal level. But also with semen allergies, I think they have to do something with Western medicine. I think that was the key. And what I've heard is that they have to do something to help block that allergy with Western meds. But I don't know what we've done with Chinese medicine with this kind of allergy. Like I said, we would approach it from like an inflammatory response, an egg quality problem, or a sperm quality problem, and then it would be kidney again, and maybe the allergic response kind of transpose it into Chinese medicine is like the lung and the gallbladder. I feel like the allergies, like the liver. So I'd probably do some Chinese medicine with that, the lung and the liver and the gallbladder for allergies. According to TCM, isn't it bad to have intercourse during the menstrual cycle? Yeah, I read that too. And you're not supposed to. I mean, we're not supposed to, but people do. I don't know why. Probably because it's like the hormones are flushing out of the body. So you want to, I mean, you probably not, most people think they cannot get pregnant during the menstrual cycle, but people do get pregnant when people are having their menses. Like I said, if they have a short cycle, if they ovulate twice, you don't even know sometimes when, you know, they're ovulating. That happens with women that are anovulatory and or they're older, so they might be ovulating twice in a cycle. What is the name of the IVF clinics that caters for the Asians? Oh, let me get it to you. I have it. I'll get it, and then I'll text it into the chat, Angela. What are the 3 formulas you use during the menstrual cycle? Oh yeah, we're gonna go over that. Follicular ovulating. So in general, I'm just gonna say the general formulas. I do have a case study that I've kind of go over the 3 formulas for each of the cycles. And then Evergreen has wonderful formulas for the 3 phases of they do 4 phases, the blossom, that will address, those formulas address each issue in the menstrual cycle. Blossom 1, 2, 3, 4. I'm going to go over that too later. Oh, this is a male patient. So yin and yang. Yeah, that would definitely be like a kidney jing. That would be like a kidney and also a liver. There would have to be, sometimes with the high yang, if there's dampness, I would do, the long dun jiegantang to drain them a little bit. That's the only thing hormonally I could think of if it's like a prostate or something like that. For the yin and yang high. Okay, let me check the chat. I think we're gonna take a little break. Please repeat the whole question fully and clearly. Oh, dang. I'm sorry. Okay, I will, if you guys missed any of the questions, I will repeat it after the break. I don't know what the question she was answering unless she reads the full question. Yes. Okay. I will read the full question. When we get back, I will repeat the full question. Okay. So I think we're going to take a little break. Let's just take a little 15-minute break. Sound good, Donna?